Hi everyone, my name is Nicole Getz. I am a BSN nursing student at Indiana State University, and today we will be discussing obesity. Obesity is common in the United States. The population at risk is large since it is so common. The obesity rate in 1999 and 2000 was 30.5%. Which increased in 2017 and 2018 to 42.4%. Obesity does affect some groups more than others. Non-Hispanic Blacks had the highest rate adjusted by age, as well as young adults are also prevalent to obesity. These statistics come to us from the Centers for Disease Control and Prevention, known as the CDC. Obesity is described as a weight that is higher than that is considered a healthy weight for a certain height. The body mass index, or BMI, is used to determine obesity. There are three categories or classes of obesity. Class 1 is a BMI of 30 to 35. Class 2 is a BMI of 35 to 40. And Class 3 is a BMI of 40 or greater. Our learning objectives for this presentation: at the conclusion, we will be able to identify common medical conditions that obesity can cause. We will be able to recall risk factors for obesity and describe different ways to treat obesity. We will be able to identify ways that one can achieve and maintain a healthy weight. Please stop the presentation now and take the pretest in the link below. Please return following the pretest so we can further discuss obesity. Thank you for returning to this presentation. I hope you did well on the pretest. Let's continue our discussion. As we stated, obesity is becoming more common in the United States. According to the NIH, which is the National Heart, Lung, and Blood Institute, there are many medical conditions that can be related to or brought on by obesity. The factors are noted to be some of the leading causes of preventable early death. Some of these conditions are heart disease, high blood pressure, atherosclerosis, stroke, diabetes type 2. There are certain types of cancers and also sleep disorders. Let's talk about some causes of obesity. Energy imbalances causes the body to store fat. This happens when your in energy exceeds your out energy. The amount of calories you are taking in is exceeding the amount that you are putting out. Let's discuss this a little further. Energy is measured in calories. Energy in is the calories we consume from food and drinks. Out would then be the amount of calories that our body uses. Our body uses energy for many things, such as breathing, digesting food, and regulating our body temperature. Another way that our body uses the energy is when we are physically active. So again, obesity can result over time when we continue to take in more calories than we lose. Again, when the energy in is greater than the energy out. Some other causes of obesity can be due to genetic syndromes. We will not explore deeply genetic syndromes in this presentation, but one genetic syndrome associated with obesity is called Cohen syndrome. This is a genetic disorder in which the body has diminished muscle tone, and there will also be abnormalities of the body. Another cause of obesity may be related to endocrine disorders. One disorder is hypothyroidism. Hypothyroidism is when we have low levels of the thyroid hormone, which will result in decreased metabolism and then weight gain. Cushing's syndrome is another condition that can be related to obesity. This condition is when people have high levels of glucocorticoid in the blood, such as cortisol. This results in making a person feel as though they are under a great deal of stress, which results in an increased appetite. A tumor can also cause obesity if it develops near certain areas of the brain, which helps us control our hunger. Let's move on to risk factors. Unhealthy lifestyle habits, lack of physical exercise. We can reduce our screen time and become more active. Unhealthy eating behaviors, again, eating more calories than we're using. This takes us back to when we talked about the energy imbalances, eating too much saturated fat, foods that are high in sugar, not enough sleep. According to the NIH, there are actually some studies that show a relationship between sleep and the way our bodies use nutrients for energy. High stress levels. Stress affects the brain. It triggers the production of hormones such as cortisol, which again results in an increased appetite. Some unhealthy environments that can also be risk factors, such as social or environmental factors, chemical exposures. Does a person have easy access to unhealthy foods, or do they have access to recreational parks or facilities? Some chemicals can actually change our hormones and increase the fatty tissues within our body. There are some treatments for obesity. Healthy lifestyle changes such as heart-healthy eating. It is important to eat the right amount of calories. Physical activity is so important in maintaining a healthy weight, lose excess weight, or maintain a weight loss. There are actually some behavioral weight loss programs which will help a person customize a weight loss plan. There are also some medicines that may help with obesity. Some medicines work within the brain, which will help change your urge for food, or in the GI tract, which will block your intestines from absorbing some fats. There are also some surgical procedures, which are only to be done if a person's body does not respond to those lifestyle changes or medicine. This is an example of Choose My Plate from the previous slide for the healthy lifestyle changes, the heart-healthy eating. This slide shows us the importance of understanding fruits, vegetables, grains, proteins, dairy, all to maintain within our diet. Let's review some tips to maintain a healthy weight. Utilize a daily food tracker to record daily weights. There are many trackers that are easily accessible. This will help record your calories in and your physical activity, again, your calories out. Set specific yet doable goals. I will walk 30 minutes a day, 5 times a week, something that is realistic. Learn from your mistakes. Know that it is okay to slip. Remember that this is a long-term process. Celebrate successes. Allow this. Allow this just not using food. Go to a movie, buy an outfit, shoes, whatever you like. Just celebrate without those foods. Physical activity, again, so important. We talked about this throughout the presentation. We can walk, run, dance. We can find a friend and go to Zumba. Whatever it takes to make that activity the most enjoyable. Remember, this is the long-term goal. Also, watch for temptations. We have to learn ways to help us stay on track for the long-term goal. This takes us to the end of our presentation. I thank you for joining. Please complete the post-test in the link below. Also check out the handout, which has some other great reference tools for obesity and maintaining our weight. Again, my name is Nikki Getz. I am a nursing student at Indiana State College of Nursing, and I thank you for listening.